Hey there, and welcome. Today we're jumping into a health topic that's surprisingly common, can be incredibly painful. But here's the good news, it's also very treatable.
Okay, let's kick things off with a question for you. What's something that's often described as being just as painful as childbirth? Seriously. The answer? Well, it might not be what you're thinking.
The answer? Kidney stones. And this is what's so wild about them, right? It can be caused by something as tiny as a grain of sand, but in some really extreme cases, they can grow to the size of a golf ball. It's just incredible that something so small can cause so much pain.
And don't think this is some rare thing either. We're talking about 12% of India's population being affected by kidney stones. That is a huge number of people, so chances are you probably know someone who's gone through this. So here's what we're going to cover. We'll look at what they are, the warning signs you need to know, what your treatment options look like today, the path to recovery, and, maybe most importantly, how to stop them from coming back for a second round. All right, let's dive into our first section, a painful, common problem. We're going to get right to the basics, what these things are, and why they even form in the first place.
Okay, so the fancy medical term is renal calculi, but really, what are they? They're basically just hard little deposits of minerals that form inside your kidneys. The main culprit is when your urine gets too concentrated, and these minerals start to clump together and crystallize.
Now, here's something you might not know. Not all kidney stones are the same. A whopping 80% of them are what we call calcium oxalate stones. The others, things like struvite or uric acid stones, they're caused by different things, like infections or even your genetics, and figuring out which type you have is a huge deal when it comes to preventing them later. And where you live and how you live plays a huge part. Take a city like Bangalore, for instance. You've got the heat causing dehydration, you've got diets that can be high in salt, and you've got a lot of people working desk jobs in the IT industry. You put all that together, and it's basically a perfect recipe for kidney stones.
Okay, so we know the risks, but how do you actually know if you have one? That's what we're covering in Section 2. And this is super important, knowing the warning signs so you can get help right away.
Listen, when one of these stones decides to move, you'll know it. The pain can be just intense. It's usually a really sharp pain that comes and goes in waves, felt in your back, your side, or your groin. If you have that kind of pain, and you also see blood in your urine, feel nauseous, or, and this is a big one, you have a fever and chills, that's not something you wait on. That's a go to the hospital right now situation.
All right, let's talk about what happens next. Section 3, your modern treatment options. I know the word surgery can sound pretty scary, but you'll be surprised at how much less invasive the treatments are these days.
And here's some really good news right off the bat. Most of the time, you don't even need surgery. About 80% of the small stones, we're talking under 5 millimeters, can actually pass all on their own. It just takes some medical management, which is usually a fancy way of saying drink a ton of water and take some meds for the pain.
But what if the stone is bigger? Well, that's where modern medicine really shines. Take a look at these options. You've got things like ESWL that uses shockwaves, or URS that uses a laser. And look at that row for incision. It says none. No cuts. Even the procedure for the biggest stones, PCNL, only requires a tiny little puncture about a centimeter long. We're talking recovery times of just a few days, not weeks or months.
So, what's this whole process actually like from the patient's point of view? That's our Section 4. We're going to walk through the path to recovery using the patient journey at Arka Anagra Hospital as an example.
It's a really clear 5-step process. You start with a consultation where they get your history. Then comes the imaging, like a CT scan or ultrasound, to see exactly where the stone is and how big it is. From there, they create a treatment plan just for you. Then you have the procedure, and afterwards, they guide you through recovery and give you a plan to help prevent it from happening again. Of course, one of the biggest questions on anyone's mind is, what's this going to cost? This table gives you a really transparent idea of the cost ranges for these procedures in Bangalore. Knowing this stuff up front can take away a lot of the stress and help you plan. And who's behind this patient-first approach? This is a quote from Dr. Manohar C.S. He's a senior urologist who has done over 3,000 successful laser surgeries. That's a ton of experience, and you can see his philosophy right there. Surgery is only recommended when it's truly necessary. That's what you want to hear, right? It's all about building that trust. Okay, on to our final section, and honestly, this might be the most important one of all. Section 5 is all about preventing a second round. This is where you get to take back control of your kidney health. And this is why it's so critical. Check out this number. If you've had a kidney stone once, there's a 50% chance, a coin flip, that you'll get another one in the next 5 to 7 years if you don't do anything to prevent it. That alone should make you want to listen up for these next few tips.
So let's bust a huge myth right away. The idea that drinking beer helps dissolve kidney stones. I'm sure you've heard it, but the truth? It actually makes things worse. Yeah, it makes you pee more for a little while, but it also dehydrates you and can increase uric acid, which is not what you want. Stick to water.
Here's another one that seems backwards. Myth. You have to avoid all calcium. It makes sense, right? Since most stones are calcium stones. But the fact is, getting calcium from your food, like milk or curd, is actually a good thing. It helps bind with the other culprit, oxalate, in your gut, so it never even makes it to your kidneys. Pretty cool, huh? So if you remember nothing else from this whole explainer, please remember this. The absolute #1 way to prevent kidney stones is hydration. Just drinking enough water. It's simple, it works, and it's totally in your hands. You're aiming for about 2.5 to 3 liters every day. A little pro tip, squeeze some lemon in your water. The citrate in it is a natural stone inhibitor.
And that really brings us to the final question. A really simple one I want to leave you with. Are you drinking your 3 liters today? It's a question to ask yourself every single day. Because with kidney health, that one simple habit, it can truly make all the difference. Thanks for joining us.